I greet you from wherever you are in the world and welcome you to the first webinar of the World Association for Sexual Health for 2025. I'm Elna Rudolph, I'm the president of WAS, and it's a great honor for me to host you here today. Thank you for joining us. Please tell me where you are joining us from in the chat. I am from South Africa, and we've got guests here from America, Mexico, and all over the world. They'll tell you more about themselves as they go on. And I would really appreciate to hear where you are joining us from. You can activate the captions for this session, and you can also watch the recording of the session afterwards. So you can see we've got more. Osmar is on our advisory committee at WAS, also from Mexico. We've got Kenya. I'm always so happy to see colleagues from the African continent, Sweden, Italy, Boston. Wonderful. It is excellent that all of you are joining us, more from South Africa. And I'm sure you will hear from the editor of our journal, Eli Coleman, how passionate we are about getting researchers from the Global South published. So I believe you will pick up some great tips today. I first just want to acknowledge that we are meeting each other today at a time where sexual health is under serious threat globally, and the hard-earned progress that we've made in many countries around the world is under a serious threat. And it's now more important than ever that we stand together on many levels, but producing evidence, scientific work in sexual health is of utmost importance for policymaking and also for clinical services. And what we are gathered here today to do is to inspire you, to equip you, and to help you to get more scientific evidence and research out there regarding sexual health and sexual rights. So thank you very much for joining us. I just want to tell you a little bit about WAS. We have a conference coming up, and it is in Australia in June, from the 16th to the 19th of June in Brisbane. And if you've never been to a WAS conference, but you are a sex researcher, I strongly encourage you to come. Please come and see what WAS is all about. It's a wonderful event where you learn about sexual health and rights, but the nicest thing about it is meeting the people behind it and becoming friends and supporting each other. So please come and join us. I hope that if you are here, you've already submitted your abstract. The abstract submission has closed, but the early bird registration is still open. So you can go to our theme is advancing sexual health, rights, justice, and pleasure, everyone, everywhere, every time. And under this political climate that's happening not only in the United States but globally, this is very important, and we are not stepping back. We know that there are many organizations that won't be able to travel, but now it's more important than ever to come together, not only for us to meet and share knowledge, but to really develop a plan to go forward and put sexual health and rights back where it belongs again. So please join us. Next. We've got declarations at the World Association for Sexual Health that has been developed over many years by the world's top experts and in a really collaborative process, as is true to the values of WAS. And there you've got QR codes for our 3 different declarations. If you take a quick snap of any of those codes, it will take you directly to these declarations. Our most recent one is the Sexual Justice Declaration. We've got the Sexual Rights Declaration and the Sexual Pleasure Declaration that has been influencing sex research lately on an unexpected high level. Next slide. You can follow us. If you scan that QR code, it's easy for you to find us on all of the different platforms that we are on. We actually left X recently. And then on the next slide, we encourage you to support WAS and to take this mission of us further. So with that, I will like to introduce you to our host, actually, the person that put all of this together, the person that is behind the International Journal for Sexual Health, and that is such a key figure within WAS and within sexual health globally, Eli Coleman. Eli Coleman, PhD, is Professor Emeritus at the Eli Coleman Institute for Sexual and Gender Health at the University of Minnesota Medical School. He is the editor-in-chief of WAS's official journal, the International Journal of Sexual Health, and he's one of the past presidents of several sexological organizations, including WAS. Eli, thank you for putting this webinar together. Thank you for being the editor of our journal. Thank you for everything that you do for WAS, and thank you for leading the rest of this webinar.
Well, thank you, Elna. You have been an amazing supporter of the journal, and this is certainly one of the ways that WAS promotes sexology around the world. And I'm just really pleased to present this webinar with you, and I want to introduce our amazing panelists, members of our editorial board, and then I'll tell you just a little bit about the journal. But the main focus of this webinar is really trying to help people be more successful in publishing in our International Journal of Sexual Health. We received so many wonderful submissions, but I think that we are frustrated sometimes that they're not prepared in the best way. And we would love to have more successful submissions being published. And so our panelists here today are going to try to give you some tips on what they see as reviewers as common mistakes, and really suggestions of how you can be more successful with your submissions to the journal. From left to right here, I just want to mention Eusebio Rubio from Mexico, the director of the Mexican Association for Sexual Health, Debbie Herbenick, who is at the Indiana University School of Public Health, and Manuela Peixoto from Portugal at the Oncology Institute there, and Xiangnan Chai from China. And so it was hard to select from all the amazing editorial board members that we have in the journal. But I wanted to reflect the interdisciplinary nature and international aspect of the journal. So that's sort of the reason why I selected these individuals. Eusebio represents medicine. Manuela is a psychologist. Xiangnan is a sociologist, and Debbie is in public health. That doesn't reflect all of the disciplines. As you know, sexology is the interdisciplinary science of human sexuality. But our journal is interdisciplinary in focus, and it is also international in focus. So we receive submissions from all over the world. And many people not speaking English as a first language. We have 5 or 6 languages in our panelists here today, and yet everyone is challenged to write in English, and this is certainly a challenge for anyone who has had to learn a second language. And so this is an amazing group of people that I think you will appreciate what their words of wisdom have to say. I just want to talk about for a moment how fantastic the journal has been growing. Our impact factor just keeps on going up and up and up. 2.2 was the most recent. We're waiting for our 2025 impact factor, but it is well cited. The downloads just keep on increasing, 134,000 in just this last year. And that just keeps on growing and growing. We pride ourselves in quick acceptance, approval. Sometimes it takes a little longer, but we try to get some first decisions almost immediately, and then try to get the reviewers to complete their tasks and get you feedback on. And then many articles do go through a resubmission process, refining. The reviewers give very careful feedback and suggestions. And when you follow these, that's another way that can really improve your acceptance rate. And again, we have a 15% acceptance rate. So I know it's always discouraging to submit something and not get accepted, but we really try to give you feedback on how to improve your manuscript. And we'd love to have that acceptance rate go up, but the reality is that we want to maintain the highest quality. We only have so much space in the journal, and so we really just only publish the very best papers. So with that, I'm going to introduce Eusebio Rubio, who will start out this webinar. Eusebio is a medical doctor who completed his PhD program in human sexuality at New York University. He founds and directs the Mexican Association for Sexual Health and has been associate editor of the Journal of Sexual Medicine from 2008 to 2014. And obviously, he's a member of our editorial board, and he is one of the illustrious past presidents of WAS and was my secretary general when I was president. So we go a long way together in this journey with WAS. Eusebio, thank you so much for joining us today and sharing your wisdom.
On the contrary, thank you very much for the invitation, and I am honored to share with you, well, the result of many years of trying to enter the English environment, not being a native English speaker. And I will share with you a number of, the initial question when I was invited to the seminar, to the webinar, was how to publish in the International Journal of Sexual Health. So I decided, okay, I will think I am a prime author with the first manuscript. So what I need to do to share with you. So this is a slightly different way of presenting. I will be in front of the slides, but I need to stand up. Otherwise, you will not see nothing of my presentation. Give me a minute. Okay, so I will be around here and I will share with you little by little. So I decided to show an outline for the, see, this is the title that I was suggesting. It is, really what I was going to be, but I decided to include some other things in the process of, okay, I want to publish, this is what I need to do. So the outline is follow the tips, if you want, which is follow the publisher's indication on the structure and other instructions that the publisher offers, follow standards of research, use statistics sensibly if you are doing a quantitative research, consider ethical aspects for design and for the execution and publication, and a small reflection on artificial intelligence, which is something new, which is creating some problems, but it's a very powerful tool. So let's start with the beginning. The first thing you need to do is to go to the publisher site. And this is for the Journal of the International Journal of Sexual Health, of any journal. All of them have specific sites. And they are very precise indications. And you go to the site when it says author's instructions. And there you will find that you are recommended to follow specific guidelines. You can get these specific guidelines, which is the result of an international committee of journal editors. It is a big effort, an international effort, and it's a large document that you can read. So this is the standards. And from this, I believe the most critical part is to understand the reporting guidelines. The reporting guidelines is really a result of effort of many researchers, publishers, editors, and they are published for specific designs. So the first thing you have to be clear is what kind of design I am intending to perform, and this is much before sending your manuscript to publish. And then once you have identified the specific methodology that you're using, then you go and look for a specific guidelines. And there are very useful sources. The best source I have been familiar with is a network which is named the Enhancing the Quality and Transparency of Health Research. And this is a wonderful site, and there are number of different standards for the specific kinds of studies. So you see the consort, the stroke. If you're not familiar with this, get familiar, read. They are very well organized, they are very clear, and then at the end, they usually have a list that you have to check before sending your manuscript. And just to give an idea, the number of standards that have been produced is really enormous. These are the principles, but you can see down there, there are more than 600 standards depending on the design of your study. So this is the first thing you need to be clear and to follow these recommendations. As you can see, this is just the main types of guidelines represented in these slides. Okay, so use statistics sensibly. I decided to use that word, because the statistics have become very easy to produce. That is exactly what has happened in the last years. Now, I remember when I was doing my PhD many years ago, being able to use this software, well, you need a lot of money. It was very expensive to get it. Usually, the large universities, the strong universities have these packages, and they have become more and more available. Today, even these traditional packages are now very accessible. But since some time ago, a development happened, and this is very important. The access to producing statistics became free. So, and that is very good, but it has some problems that I want to state. The basics for this is a project called the R project, which is really a programming language. You really need skills to use this thing, which is free. But after some years of this, the availability of these packages, which are packages for every single statistical test and sophisticated test, there were at least two resources that I am showing here. One is, and I'm sorry to pronounce because I'm not sure how many people do the JAMOBI and the JASP. Those are packages produced by universities and made available for free. So this is very good. You can learn to produce statistics, you can test your data, but there is a drawback. The easiness in which statistics are produced, this is part of the experience reviewing some papers, it creates the easiness to produce a large number of statistics that are reported. And I believe one of the key things to use statistics is that the statistics you produce need to be connected to your research question. Otherwise, you can fill out your manuscript with a bunch of correlations and a bunch of numbers that just show that you know how to produce statistics, but the making sense in relation to the questions you are trying to answer is the critical part. So in summary, the statistics, I believe, should serve as describing who participated in your study. That's important. The descriptive statistics are very important for that. And the inferential statistics need to be a result directly from your research questions. If you report statistics that do not relate, that just feels numbers, numbers, numbers. It shows that you can produce statistics. That is very easy today, but not necessarily good research and good practice to get your manuscript published. Then you need to consider the ethical aspects all the way around, from design to execution to publication. And this specifically in the medical research, in the clinical research, is very, very important because we as clinicians have power over participants in research. Power that means that you are in the clinic, you are giving treatment, and that creates an ethical problem that it is much more important than in other researches when you do surveys or other forms of research that will be commented today. Well, you have the participant deciding to participate, and that's it. You have to inform them, but if they are part of a clinical service, then there is a special risk of being utilized in an unethical way. That is why, and this is the history of this is very, very critical, where there's been very problematic problems in which the research has been made in not an unethical way. So there is a very interesting paper. It's a little old, but it's produced in JAMA. It's available. I am looking at the reference, and I'm just making a short summary of what constitutes ethical research, ethical clinical research. It has to have a social and clinical value. It may be very interesting, but it doesn't serve the benefit of society, and it doesn't have a clinical value. Well, perhaps it's interesting, but not valuable. Then it has to have scientific validity. That means this has to be produced with these principles of science. The subjects have to be fairly selected to the participation. It is very easy, and it's a fact, a problem that some segments of the population are not easily included. For instance, just to give an idea, the number of data that we have for females is not equivalent to the data that we have for males, and this is a result of the unfair subject selection. Then there is always some level of risk. It is very difficult to produce research, especially in the clinical arena, when no risk for the subjects are. So this needs to be clear and evaluated. So the balance needs to be positive. Then the independent review, it would be very, very useful to do the review among ourselves and then to collect with friends and colleagues before sending it to publishing, and the publishing, then it goes for the independent review, and the informed consent. The informed consent that I already announced, that is very, very important, and respect for potentially enrolled subjects, that especially the fact that they can decide to withdraw without any consequence. So the informed consent, and this refers to one of the comments that I will make at the very end. This is a summary I produced with artificial intelligence. And in the reference, I am referencing. This is something I produced with Chrome, with the Google intelligence. So, but the summary is very good, so I decided to use it and to show. So what the informed consent works? Well, participants need to be fully informed. Participants need to be, they have the opportunity to consider all options. Participants are made aware of the right to withdraw. I decided already. And participants made aware of the foreseeable consequences of withdrawing, which need to be known, as I mentioned. Why is it important? It is important because it is a right of participants. It is a process to take care of them. And the rest of the summary, I will let you see them, and perhaps you will have access to this presentation to look it in detail afterwards. So this is, of course, it is important to keep the document. The researcher has the obligation to document the fact that he obtained this informed consent. And the last comment that I will make, this is the artificial intelligence. This is a very powerful tool. And I believe we should learn to use it and to understand how this is produced and understand its limitations and its possibilities. I think the strongest force, the strongest characteristic of the artificial intelligence is the ability to search the available knowledge in the web. That is impressive. It is very, very powerful. However, it has limitations. And these limitations need to be aware, the researchers need to be aware of the limitations and not to follow blindly the suggestions and the conclusions of the artificial intelligence. And of course, using artificial intelligence output as our own product is something called plagiarism, and we need to avoid it at every level. If we use it, we need to recognize. So there is recently a very useful publication by this author, Ethical Use of Artificial Intelligence in Scientific Writing. And it is again very, very clear summary of what is so to keep you need to keep records of the systems used, the date, and the queries that you enter. You need to check all references for accuracy, because sometimes the references are not very, very good. You need to check the program for your paper for plagiarism and assure that the language is used unbiased and inclusive. Study the field and inquiry independently of what the artificial intelligence does. And this has to do with the knowledge that the researcher should have in order to be used. And there's other recommendations that you can consult in this particular publication. So to finish, publishing is the final step of approaching a problem with the scientific method in mind. Publishing should adhere to the requirements of the publisher, as we started, the scientific standards of conducting and publishing research, the ethical standards of informed consent and approval of, I didn't mention this, but usually institutions have an independent committee to review the ethical aspects, and the ethical standards of referencing, giving proper recognition, and others if you use artificial intelligence. So this is my presentation, and I thank you very much for your attention. Manuela Peixoto is a PhD in psychology, clinical and health psychologist. She's from Portugal. I don't know if you live in Portugal, but you are also from Portugal, Manuela, I believe.
Yeah.
And she's a sex therapist and a cognitive behavioral psychotherapist. Currently, she's working at the Portuguese Institute of Oncology in Porto, very nice place, and member of the oncosexology group of the IPO, which is the Institute of, I don't know what the IPO is, but it's an institute in Porto, and is very well-known researcher in sexology, oncosexology, and clinical sexology. She publishes a lot, so we know much more of her by her publications than personal. But Manuela, your time.
Thank you so much, Dr. Eusebio, for your kind presentation. Hi, everyone. I'm Manuela, and I'm from Porto, Portugal. It's a pleasure to be here, sharing my experience as a member of the editorial board of the International Journal of Sexual Health, and learning from all of you. I will now share my presentation. When I was preparing my presentation, I go to see the previous papers that I've been revising for the journal, and I try to collect the main issues, the common mistakes researchers do when they submit their articles and they are being rejected due to that mistakes and errors and some flaws that we found there. So I started with the psychology field. So when we are doing research in psychology, we used to use a theoretical background or framework or theoretical models to inspire our research question. And what we see most of the times when papers are being rejected is that the introduction the paper presents did not uses a specific theoretical background, or if it uses, it did not mention that in the paper. So we are not, the readers are not allowed to see which theoretical background justifies the study purpose. So it is important for the readers to see which are the main guidelines in terms of theoretical models, to see how the researchers will raise their hypotheses and their research questions. Another issue that is linked to the first one is when the authors did not clarify or did not present or define the theoretical concepts. When we have something like a personality trait or a cognition, we need to present a definition, and we need to specify the definition and the theoretical background associated with that definition, as long as we also need to present the link or the relationship or the interdependence between the concepts that we are going to use in our study, so the readers can go see the link we are looking for, and they start to wonder in their mind what we are about to do in our study. This is also important for the next paragraph, or the last paragraph of the introduction, where it is important to have a study purpose or goal and pointing some hypotheses. So I have a theoretical background, I have my study variables, and which are the link between these variables? What do we already know about this? And what do we miss in the literature? So this will be my study purpose, my goal, and I have to intend some hypothesis that I will answer to the scientific method. Some other issues are related with the introductions, and others with mainly with the discussion. When we go to the discussion, which is the part that most readers like to see and go with more depthness, we need to see the integration between the results found in the manuscript and the theoretical background. And when we are saying the results or the findings, we want to see discussed the significant and the non-significant results. Some papers lack the discussion of non-significant results. They just say, well, we did not find a significant statistical connection here, or our hypothesis is not achieved. So we need to see the discussion on this, why this is happening, what are the possibilities, the possible explanations. We want the authors to raise new hypotheses and to discuss the study limitations and future directions in a deeply way, as well as considering new research lines or sometimes proposing new studies, and being really specific about study limitations and not stating general things like small sample or not heterogeneous sample, things that are really specific to that study. So, and linking, of course, the discussion and the results with the introduction, which is according to the literature, which is not, and why do you think this is not linked with the literature. Why this is happening? Because sometimes non-significant results may lead us to new areas that need to be deeply explored. Another issue and common mistake is lack of references or lack of updated references. Of course, when we are citing theoretical models, we will need to cite articles from the 80s or the 90s, but the last 5 years, what are the main papers in the field? What did they found? What do we have? And to sometimes when I was a student more than 20 years ago, my professors always saying that when we are constructing an introduction, we need to go to the first paper or the first ones, to the last one, and somewhere in the middle to show the reader the path that the field or the subject is going through, when it begins, how it went, and where it was now. So it is expected for an article in the psychology field to have this guideline. Where did the model start, and how is he being looked at now, with specific information on other models that can contrast with the one we are studying, and to discuss the different positions in the literature. By that, I mean, we are not, when I study a model, that does not mean that is the best model. It's the model I use, but it may not be the best, but it's the one I choose. So there are other models, and it's important to discuss the pros and cons of both models. So it is important to have references for every of each of these informations, and to discuss this in a deeply and proper way. So this is the main common mistakes and errors during submission process in this journal, and I believe in many other journals in the psychology field. As I work or worked in the LGBT and sexual minorities, sexual health and psychology field, I also try to address the common mistakes in this particular field in psychology. So when we are talking about specific groups, in this case, the sexual minorities, what do we see in the International Journal of Sexual Health as board members as editorial board members? We see mostly in the methods section. Here it's more in the methodology, when authors did not address properly the sample. By this I mean they did not include the sexual orientation or gender identity information. Sometimes it's just non-heterosexual sample. Okay, what does this mean? How was the sexual orientation measured by the authors? Is by self-identity, self-labeling? Did they use a Kinsey scale or any other scale about sexual orientation? Do they consider past sexual behaviors, or are they considering and combining sexual behaviors and sexual desire? If they don't even question the sexual orientation or gender identity, and why did they not question? Because that can happen, and can be authors can have a good reason to do that. And we are talking about sexual orientation, where we can try to approach by sexual behavior, by sexual identity, by sexual desire. Currently, the most consensual definition, it's about self-identity and self-labeling, but for the purpose of the study, it makes sense to use past sexual behaviors, and that should be stated explicitly in the methodology. About gender identity, it can be important too, because when we are talking about sexual minorities, we need to be specific about this. Are these cis people or trans people? Are they male, they female, other identity in terms of gender? Which options do the participants can answer? Which percentage did not answer? All of this is important for studies in this field, as well as a detailed information in procedures and methods section, like Dr. Eusebio was talking about ethical issues. We are talking about having ethical board approval and informed consent. We received some papers that did not receive ethical board approval, and this is not allowed. We received papers that did not include informed consent, and this is not allowed. So we are doing science and using the scientific method. So we really need to be careful with these kind of things, presenting the age of the participants, noticing that for some countries, the legal age to attend a study is 18, others may be 16, and this need to be clarified in the manuscript. We are also talking about sample recruitment. How was the sample recruited? It's recruited online. It's on university context. It's with help from LGBT associations, because all of these matters, as we are when we use, for instance, LGBT associations, we probably are recruiting a specific type of sample with a specific characteristics that may not be generalizable to the overall community. And this is a limitation that needs to be acknowledged. But for this to be acknowledged as a limitation, this needs to be stated in the method section. Also important to have a description about self-report measures. It is really important to use reliable and validated measures. And if we are not able to use that type of measures, which ones we use and what are the psychometric properties of that measures, to describe statistical procedures, because in the most difficult, the major difficulty that we have in this type of studies is that they have so brief informations on their methods that did not allow any reader to replicate the study according to information provided. And as we know, it is supposed to a study to present enough information for us to replicate it if we want to. So this is the major common mistakes and errors. And another one that is transversal to psychology and LGBT sexual health is this specific one. When we are doing research, we are using the scientific method, but we also need to think, why are we doing this research? For what? With what purpose? How this can help clinicians, how this can help research, how this can help academics. So the link between science and practice should be stated in the manuscript. It is really important to be clarified in the manuscript, the link between the science and the clinical practice. After all, we are a journal about sexual health, and most of our readers are clinicians, so we need to be aware of that. Thank you so much. Let me finish my presentation, and now I will present my next colleague, Dr. Xiangnan Chai. Dr. Chai earned his doctoral degree from the Department of Sociology at the University of Western Ontario. His research focused on health and health inequalities, as well as population aging and the life course. He has published scholarly articles in journals specializing in public health, sociology, and gerontology, and his current research projects explores health lifestyles, health literacy, and digital health within the context of population aging in China, Canada, and beyond.
Okay, thank you so much, Manuela, for your introduction. And for your presentation and for introducing me, okay, to the audience. Thank you so much for this wonderful opportunity. I'm Xiangnan Chai. You can call me Chai, because Xiangnan is not easy to pronounce, I guess. So I'm from the sociology department of Nanjing University. I'm an assistant professor now. And okay, sorry. Here's my Google Scholar account, and I'm also on ORCID and ResearchGate if you want to find more information about me, so you can Google me. And okay. And I want to say that thank you, Eli, and the editorial team, and all members of the editorial board for your exceptional work. And as a member of the editorial board, I really learned a lot during the past 1 to 2 years. And I really love the journal cover. Okay. So today I wanted to share like 5 major points with you. So the first is publishing articles using international data sets, because I know many of the audiences are from countries beyond North America, yeah, including me. Okay, I'm an author too. And publishing articles using data sets based on convenient sampling methods, and publishing articles using mixed research methods, and publish topic-oriented articles, but without data analysis, because I have reviewed 1 article or maybe 2 articles, which can be classified as topic-oriented articles. And also, I want to discuss with all of you about some improvements of the Scholar1 system of International Journal of Sexual Health. So let me see. Okay. So publish articles using international data sets, because I know many of us are from countries and regions beyond outside North America, right? We're not from Canada, we're not from the United States. So while some of the data sets are nationally representative, adhering to rigorous data sampling methodologies, such as the Chinese General Social Survey, because I used these data sets to publish articles, okay? So I know the sampling method is very rigorous methodologically. Others maybe not, right? Others may not meet the same standards. So it is therefore very essential and important to request that the authors to provide detailed documentation regarding the data sets they utilize, such as official websites or peer-reviewed publications in reputable journals, such as International Journal of Sexual Health, to ensure the transparency and the reliability. So this is my opinion, because I reviewed many articles for this journal and some other journals, okay, some other reputable journals. And when I, because I'm using majorly I'm using quantitative methods. So when I reviewing some papers using nationally representative data sets, they clarified. I always require them to provide detailed documentation or a web page, right, of your data sets, and readers or reviewers or readers download the data set, right? So it is downloadable, and can we read it? Like, is there any version in English, right? So we can read it, we can get to know more about the details of the data set. I think this is important for the authors to provide or to offer to the reviewers when they submit their manuscripts to the journal. So this is my first viewpoint. And the second one is publish articles using dataset based on convenient sampling methods. So actually, I know it is really hard to collect dataset that is nationally or regionally representative, right? Because it takes so much money and time, and as especially as an independent researcher, you don't have much time and money to do that, right? So often we try to collect data using convenient sampling methods, right? We collect data online, or we collect data in a small community by using some like some sampling method that are not random based, so non-random sampling methods. So I have reviewed some papers with limited sample sizes, such as a dataset with 350 samples, right? I think that can be considered as a small sample size in sociological or psychological research. So it is recommended that the authors, I always recommend the authors to provide a clear rationale for the use of such data sets. I think this is super important for reviewers to know why you collect data in this way, right? And you need to address potential limitations associated with this sampling approach. Because we all know that convenient sampling methods have limitations, especially when you use this small sample size dataset, right, to do statistical analysis, and you draw a conclusion on significance or non-significance between X and Y, right, based on some statistic models. So you call it scientific, right? We always want to get scientific findings based on statistics, right? But your data set is based on convenient sampling method. So you need to address this limitation or maybe more than one limitation, right? A couple of limitations associated with this sampling approach. To be honest, right? You need to be honest about these limitations. And more than this, authors should outline the ethical considerations, ethical approval, and the protocols during the data collection, okay? Because ethic considerations are always there, and you need to do ethical approvals. I reviewed many papers, and some of them did not give any information about the ethical approval, okay, of their data collection. I think that's not good for a reviewer to read. When as a reviewer, when I read such manuscript, I feel not good, because if you don't provide ethical approval information to us, I would question the ethic considerations or ethic related problems or issues with your data collection. So I think that is important to ensure the methodological rigor and your academic integrity. So this is my second viewpoint. And my third viewpoint is about publishing articles using mixed research methods. So basically, I'm using quantitative research methods, but also I'm using qualitative ones. So I use I do interviews in the community, and I use thematic analysis. I use MaxQDA or NVivo to do data analysis. So I know the mixed method, like the mixed method is prevalent for sociologists or other social science areas or other social science, social scientists. So my question for you or for the editorial team is that are there any established criteria or standards to assess the validity and the effectiveness of the mixed methods research? Because I know that doing research using mixed methods is not easy, right? You need to use both, right? And the coherence of the integration between qualitative and quantitative components, and the extent to which the combined approach addresses the research questions of research objectives should be assessed, right? Should be assessed regarding the validity and effectiveness. So establishing clear evaluation standards, I think it's important. It's crucial to ensure the methodological soundness and the credibility of studies using mixed research methods. So this is also my question, right? Because maybe in the future, in my submission, I may combine qualitative and quantitative research methods, right? So that's my question, and I put it here to discuss with you, okay? And okay. So my fourth viewpoint or my fourth point is publish topic-oriented articles without data analysis. So what is topic-oriented articles? Actually, it's my classification because I have reviewed some papers like that. So certain articles are topic-oriented and lack data analysis due to data limitation because they don't have data, right? They don't have data. But these topics often hold significant relevance within specific social cultural contexts. I can give you an example now. So I reviewed an article about the topic of fourth love in China, in mainland China, among young people, among the young Chinese generations. Actually, I didn't know what is fourth love before I reviewed this paper. And after reading that manuscript, I get to know the point of what is fourth love, and I know how hard it is to collect data about fourth love in China, especially collecting data among young women because it's a very sensitive topic, right? So, but these articles, these topic-oriented articles, they are important, right? The question is how to evaluate such submissions, right? It is important to consider their theoretical contributions and the contextual insights, right? And the potential implications of these studies on like policymaking, even in the absence of empirical data, right? Because in like I think the example I just offered is not an independent one. There are so many similar examples there, right? Not just in China mainland, it is everywhere in the world, across the world. So I think we should take this into serious consideration, right? So my suggestion is that a balanced approach to acknowledge the value of their conceptual and theoretical contributions, while encouraging the authors to transparently address data limitations. Because you need to, of course, as an author, you need to address the data limitation and maybe appropriate for assessing the merit of these submissions. So I didn't give a desk rejection or direct rejection when I read when I reviewed such papers. I often go deep and deeper into their conceptual and theoretical contributions. So I think it's important because, of course, as social scientists, as a sociologist, we always want to, have data, right? Either quantitative or qualitative. We always want to have data, but, due to the constraints outside, we cannot always have the data what we want, right? So we need to acknowledge this reality and to recognize the contributions of such submissions. So the final one is about some minor improvements of the Scholar One system of IJSH. Okay, so well, although I wrote it here that some improvements, right? But I only found one. Okay, I only found one, but maybe other audience, maybe the audiences have more suggestions about how to improve the submission system. So I found that the submission system currently lacks the option to select categories for research articles other than original research. So if an article is categorized as a policy review article or a systematic review article, or a topic-oriented article, are they all automatically classified as original research or some other types of research? I don't know. This is my question. Okay, so also a minor suggestion for the improvement of the submission system. So that's all what I want to share, and I would like to discuss with all of you afterwards. Okay, thank you. Okay, now yeah, I'm going to introduce Dr. Debbie Herbenick. Dr. Debbie Herbenick, I hope I pronounced your name correctly, is a provost professor at the Indiana University School of Public Health, Bloomington, director of the Center for Sexual Health Promotion, and an ASECT certified sexuality educator. Her newest book is Yes, Your Kid: What Parents Need to Know About Today's Teens and Sex. Dr. Herbenick's research focuses on women's sexual health, U.S. population, representative research, as well as trends in sexual attitudes and behaviors. She has published more than 220 peer-reviewed scientific articles related to sexual and reproductive health, and serves as principal investigator of the award-winning National Survey of Sexual Health and Behavior, which has been ongoing since 2009. And I just Googled Dr. Debbie Herbenick's, Google Scholar page, just Google it, okay? Her citation is so high, okay? She's so famous, so well-known scholar in this area. Okay, let's welcome Dr. Debbie Herbenick. Thank you.
Thank you so much for that warm introduction. Thank you. So I know we are closing in on time, so I want to be really attentive to that and make sure we have time for questions and responses as well. You can go to the next slide, please. And so you have gotten so many wonderful bits of information and advice and suggestions for publishing today. And so I'm going to add some perspectives from the field of public health that come up quite a lot in the reviews that I do for various journals. So for one of the things, we heard earlier how important theory is, and it really is to so many articles. There's an exception to that, though, which is surveillance studies. And so surveillance is a core feature of the field of public health, and that is that we track things. We track changes in attitudes and behaviors. We look for patterns of disease distribution. One of the things that I've experienced myself as a writer is, I think, assuming that people know that surveillance is a core function of public health and that it doesn't typically involve theory. So I have found it easier myself to publish when I say that up front. And I mention that, which introduces the readers to the discipline. And so I think that as a broader concept is helpful for us to all remember, is to examine the things that we sometimes take for granted in our own disciplines and to more clearly communicate them. Because it is very likely, as Dr. Coleman mentioned, we are this interdisciplinary field, and it is a strength and it's a richness of being sexologists. A challenge with reviewers is that we sometimes need to communicate some different aspects of our field. So for those of us doing work in surveillance, I strongly encourage you to just talk about that up front. And if theory has not driven your work for some reason, to go ahead and just say that and to describe that as you go forward. Clearly listing the study aims. And then I think, as one of my mentors helped me to to realize when I was already several years into my career. Not only does it help to clearly list your study aims, but it really helps to continue that structure throughout the rest of the paper. So to use that same order of the aims when you present your measures and when you present your results as well, can very much help the readability of the paper for the reviewers. If the study is meant to provide prevalence estimates, and not every study needs to do that, then the study should involve probability methods for the sample. This could be nationally representative data, probability-based sampling, for example, in a college campus, or probability-based sampling in a city, state, province, or other defined sample. But if it's not meant to provide prevalence estimates, that's okay too, right? You can describe the characteristics of your sample, but where we sometimes see things get a little challenging is when people find, for example, that 12% of the people who responded to their Twitter survey, indicated that they had masturbated, for example, and then they use that to indicate that it's a prevalence estimate of the percentage of people who masturbate. And it's not a prevalence estimate. It's a characteristic of the sample. It's data from the sample, but it is not meant to be extrapolated to the general population, for example. Not even of Twitter users, right? Unless there was probability sampling used in some way. So really making sure that that distinction is clear. And then clearly indicating response rates for surveys. A lot of my research involves surveys. Response rates are not always possible, especially if you're using some online sampling, and that's okay. Just say that. If you say that up front, due to the way that we sampled, we're not able to determine a response rate, that will save some back and forth with the reviewers when they ask you for more information about your response rate. If you are able to create a situation ahead of time where you can determine a response rate, that can be very helpful. So for example, at different points in my career, I have used classroom sampling. Well, if I just go and hand out a survey, and I don't bother to see how many people are in the room to start with, then I'm not going to be able to get a response rate. So I learned even for things like that, if I was going into a classroom, I was going to count the number of people in the room and then count the number of surveys I got. So you can be proactive to get a response rate if possible, but if you haven't had one, just go ahead and be really clear about that to save some back and forth. And if you're using convenience sampling, which is very common in a lot of research, try to focus on the relationship between the variables rather than, for example, those attempts at prevalence estimates, which convenience sampling just isn't set up to do. But convenience sampling is set up to help you find a lot of rich relationships between variables, and that can be the focus of your findings. Let's go to the next slide, please. And then responding to reviewers. This is something that I had some really good mentorship on, and I work a lot with my own doctoral students on when they are preparing their own papers for submission and getting responses back. It can be really easy because we love our research to feel protective about it and defensive about it and excited and defensive about our ideas. Try to, as Taylor Swift says, shake it off and let it go and try to have a really, really nice response to the reviewers. They have volunteered their time. They have volunteered their expertise. They and the editors are sharing good feedback with you. So try not to take it to heart, but try to see how it can help to make your manuscript stronger. So clearly listing reviewers' comments and your point-by-point responses to these comments not only helps ensure that you have done everything that you can to be responsive, but it clearly communicates that to the reviewers and to the editors when they're going through it. So I often encourage my students to start with thank you for this helpful comment. We appreciate the suggestion. It may seem like a small point, but I have seen some back and forth as a reviewer where people do not offer this kindness and can be short and curt, and it doesn't always go well, right? We're all humans and we can be sensitive. So try to put your best foot forward with some kindness as well. And it's also okay not to take every single, comment into something that changes what you do. In my experience, I do make changes for the vast majority of things, even if it's something that I can't change that I did about the study, but I can go in and say, well, you know, I can't change this part about my method, but I'm going to list it as a limitation in my discussion. And I'm going to talk about how subsequent research might take this into account. I have seen some really, really strong examples where you can tell that the authors thought about it, grappled with it, ultimately decided that the suggestion from the reviewer was not something that they felt comfortable doing or felt it was a good fit, but really calmly and professionally, they explained why. And they just, you know, they shared their rationale, and they indicated why they couldn't make a particular change. And then, you know, and that was fine. Because that's what the review process is. It's an exchange of ideas. It's an opportunity to strengthen your manuscript. But you also don't need to think of it as a mandate to do every single thing if it's not really the right fit for your work. And so, you know, with this, I think that once you get your responses to reviews, if you're being as responsive as you possibly can and being kind and professional back, you have a really good chance at moving on to a successful acceptance of your paper. And I think that's it for I have for this, so we can move on to the questions next. Thank you so much.
Thank you, Debbie, and thank all of the panelists. Again, we didn't organize this together, but everyone covered different aspects and different tips, and so I think this was really helpful to potential people who are going to submit to the journal. Let's go to this first question. We didn't talk too much about qualitative research, and clearly the journal publishes qualitative research and based upon good methodology. Xiangnan mentioned mixed methods, so certainly we publish things that are mixed methods, but we do publish things that are purely qualitative. I think it's a challenge, again, when you're doing qualitative research and you've got a sample of 10 people, which is sometimes very appropriate number to do qualitative research. But Eusebio, you had just are in the process of publishing an article on qualitative research, and so you might have some comments about this, and Xiangnan, you might have some as well.
Yeah, and I felt a little guilty because I was assigned to cover qualitative research, and I really didn't mention it. So this is my opinion. Qualitative research is very important, but it may be also a false solution to the phobic to numbers and statistics. That's my experience with my students. Many people who suffer with numbers decide to do qualitative research thinking that is easier because they don't have to deal with maths. That is a big mistake. Because qualitative research requires much more work, it is much more difficult, especially to produce research that is, you know, scientifically qualified, which means it can be reproduced by your other, not my idea. And the other problem with qualitative research is that it's justified when we don't know nothing about it. When there is an area where there is lack of information, lack of reports, then it is very important, especially in clinical aspect, clinical medicine and clinical science, not only medicine. It is very important to know the details of how the people experience a condition, be it a social condition or a disease or a dysfunction or whatever. That is, it becomes very important, but it is important, but very difficult to produce. Many people confuse qualitative research, that is my experience, to giving my opinion of talking to people. That is not research. That is a good interaction, but so and there are, we didn't cover that, but there are very fixed, very clear methods to produce reproducible research with quantitative methodology. We are in an epoch of the numbers are powerful. They are. But we need to recognize that many times we need to understand the experience, the way people is experiencing things, and many things are not possible yet to measure because we don't have enough information. So that's my general comment.
Xiangnan, do you have anything you want to add?
Yeah, so although I have limited experience in doing qualitative research, I think it's, as Dr. Eusebio just said, qualitative research is super important for at least the sociology study, right? So like sociology students, we all received qualitative training during undergrad and grad school. So I think to assessing the validity of a qualitative study is their conceptual and theoretical contribution. So of course, qualitative research is quite different from quantitative one, right? So we use, for example, global sampling method. It's convenient sampling method, and your sample size maybe 20 or 30 is quite small. It's not even small sample size. It's quite small, right? It's only for qualitative research. You cannot use a 30 sample size for a quantitative one, right? So I think it's important to highlight your conceptual and theoretical contributions, right? What have you found during your interview? Like, no matter a one-time interview or longitudinal interview, what have you found during your field study, right? I think that's something I want to read when I review a qualitative paper. Thank you.
That's great. There's a question about someone in Haiti is doing a study on sex education. And do we publish things on sexuality education? Absolutely. But, this raises an issue that I see commonly, and it pertains to research in different areas of the world, whether it's in sex education or in sociology or psychology, that, again, to do a study on some aspect and you find sort of the same results that have been replicated in many studies around the world, that is not a significant finding unless it is really framed from a sociocultural perspective of why that is the same. But you really have to think about, again, the significance of your findings for an international audience and recognizing that it may be very significant finding in your country, in your region, in your field, and it might be better placed in a regional journal, a specialty journal, rather than in an international journal. So that is a common reason that I, make desk rejections, because we studied this population in Haiti and we found that they needed sex education. Really. So it can be very significant, especially when it is framed from, again, the social, cultural, political climate of a situation. That might be very, very interesting for the international readers. So I don't know if anybody else has a comment on sexual education research. I'll just open it up for a second.
Well, I can tell that is a very difficult research to do, because most people do the classic pre-posting, which we all know that any intervention creates an effect and adds little to knowledge. But it is very important area. So the difficulty is to convey the importance of sexuality education, which is critical, and the difficulty of building knowledge. From my perspective with doctoral students, the main difficulty is to finding where you can contribute to what we don't know. In lower levels of education, because it's not bad to try to learn how to do it, to find what we already know. But if you are doing a doctorate or more, publishing in an international journal, you have to think clearly how this contributes to what is not known. And that's perhaps the most difficult part.
I think the area of research that we need in sexuality education is more not just pre-post, but really randomized control designs. We need to really show that what our intervention is better than something else. And so there's really a dearth of research using any kind of controlled or randomized kind of studies in sexuality education. So I would encourage that. There was a question about systematic review. And yes, you have to select as an original article. But again, your systematic review should be an original systematic review. So that is considered an original. And we receive a lot of submissions of systematic reviews. And the big problem with some of those submissions is just not following a particular guideline for doing systematic reviews. And so that's one very important thing about submitting systematic reviews. Looking for other comments or questions here. I just want to take a moment and say another thing about the common mistake. And again, I think the reviewers are really very forgiving, but there's a lot of manuscripts that are frankly unreadable. Again, trying to write in English is a big challenge. But when it is not written in very good English, again, the reviewers have a hard time really seeing the value of the research. So it's very important to have it really reviewed by a native English speaker. Again, you can use AI to help improve the English. But I also just want to make a comment is that you can almost smell something that is produced by AI. There is I don't know how to describe it, but it's very noticeable. It's almost too perfect. So you have to be careful on using AI even for editing. But we recently received a publication that was originally written in French, and they used AI to translate it into English, and they acknowledged, and this is now a requirement in the journal, is that you have to say how you used AI and make that clear to the readers. And so that was fine. And that's a good method of using AI. So, but I would be careful, even in those cases, that you have to not just trust AI completely, but readability of your manuscript is really important. We'll work with it and we'll help you, but it's going to get a lot more favorable review if it is simply more readable. Let's see if we have any other, maybe there's some other words of wisdom that the panel might have that they've thought of as we have talked about this here. Here, I'll open it up.
Eli, just a comment from my side as a non-researcher, as a clinician, it is really remarkable how little we know about research, about I learned so much during this webinar today, and I do engage with this and I read research on a daily basis, but it is really remarkable how little we know. So thank you that you shared the knowledge. I'm sure that there are very seasoned sex researchers on this webinar. I see the chair of the WA Scientific Committee, Eric Janssen, is here. And thank you for joining, Eric. But then also there are people who would love to get their work out there. And I'm sure that they were inspired by what you did here today. I thought of the concept of research as education, because if you look at the socio-political cultural environment, for me as a South African, there's no institute in South Africa or even on the continent where I can study sexual health as a doctor. None. We do good sexual rights work in Africa, and there's great public health in Africa, but the clinical application is not available on the continent. So how do we know what to do? Because we certainly deliver the services. We read the research. And if you guys are not producing the research, we do not know what to do from a clinical perspective. And of course, you attend conferences where experts like yourselves have read everybody else's research and have the clinical experience to actually make it practical. So that one study that is maybe small, maybe the 10 people that you interviewed, to do some good qualitative research on can change a practice in South Africa or in Kenya or in Malawi or somewhere else in the global south on a daily basis. And I can really see how that happens. And I want to thank all of you for doing what you're doing. I really enjoyed what you said there, Debbie, about the very human interaction with the people that produce the research. We are all people and we all do this because we're passionate about it. We're definitely not doing it for money or much credit or anything. This field is too small for it. And the fact that you guys, as the reviewers, as the leading researchers in the world, are taking the time to engage with the people that do try to publish in the journal. Maybe that feedback that you give them, you know, they cannot improve on this study well enough to get into the 15% that actually gets published, but they are learning from the experience, and it is so much appreciated by everyone. So I want to thank you, Eli, as the editor of the journal, the driving force, almost always the most passionate person in the room, and for leading this team, and for all of the reviewers at the journal for doing what you're doing. It is, I think, it's really, you guys are unsung heroes, and the work is volunteer work that never gets rewarded, but the work, there is reward. And I think the biggest reward is if we then see policy making that happen from the research that we've done in many fields, you know, and we can see there are so many examples of that actually happening. So I just wanted to weigh in from that from a practical perspective. Thank you very much.
And we have published papers that have done policy analysis too. So policy is also an important area of our field. All right, well, I think we're at the end of our time, and please feel free to write any of us, or certainly myself, and ask further questions. I welcome people who inquire whether their manuscript might be appropriate for the journal, rather than going through the whole submission process to find out that no, we do not publish editorials. No, we do not publish any evaluation of new psychometric instruments. So there's a couple things that, again, it's so clear that we're not going to consider it. So you can always send an abstract or something like that to me and ask whether it's appropriate. I can't guarantee publication, but I can tell you whether it's in the ballpark. So please, you know, contact any of us on the editorial board, and certainly myself. So thank you. Please submit to the journal, and we'll give it our best appraisal.